You have a choice every morning when you get up. You can make an excuse or you can make something happen. I am an office specialist in outpatient pediatrics at Hillcrest for Cleveland Clinic Children's. This is for you. Have a great day. We'll see you in a month. If you need us sooner, please call. I've gotten to know those patients like their friends and family. Someone just had a birthday, huh? And so when a patient calls and I can recognize their voice on the phone, that's huge to me. Rob and I met in December of '01, and we got married in April of 2005. About 2.5 years ago, Rob wasn't feeling well. And it ended up, it was serious enough, he went to the emergency room and they wouldn't let me take him home. And little did I know just how sick my husband was. And within a matter of a couple of days, we knew Rob had cancer.
The cancer was ureteral cancer, which is extremely rare. Clinics said they see about 35 cases in total a year, and almost always they're individuals 75 years or older. So to see someone at my age was, they were very, very surprised by it. The prognosis was pretty dim.
Within 2 weeks, Rob had major surgery and ultimately treated with a form of chemo, which is one of the most aggressive chemos. Consistently, the doctors told us that was really the only hope he had, but that chemo is extremely risky for the damage it does to the kidneys. But we knew we really had no choice. After about a year, and we were very lucky that we came out of it on the other side, I realized that I couldn't be a caregiver to anyone, whether it was at work or at home, unless I started taking care of myself. And I knew something had to change. I couldn't even actually tell you what my highest weight was, because for the first couple weeks of this journey, I wouldn't get on the scale. It was almost like it made it too real and too raw to say, wow, I weighed that. So a couple weeks into this, I know I weighed between 226 and 227. I decided I think I can do this. I don't want to become diabetic. I don't want to lose my life because I've chose to dig my grave with a fork. So I got a pedometer and I walked 10,000 steps every day. It might have been 10 o'clock at night, but I was walking laps in the neighborhood. And then I changed what I ate. There was no more pop, there was no more cake, there was no more candy. Everything was weighed and measured. And at first it was hard, but when you want something really bad, you do it. And I tracked everything I ate, and I still do. And I just started making better choices. And pretty soon the cravings for the bad food stopped. It's not, those calories aren't worth it to me. And when I started feeling better and the numbers on the scale started changing, which happened pretty quickly, I realized that this was doable. And I set a goal to lose roughly 86 pounds. That would put me at a number that my doctor and I agreed would be healthy. And I hit that in 51 weeks.
It's simply amazing what she's been able to do. And to do it on her own. There was no surgery, there was no books, there was no fancy special diets. She did it the old-fashioned way. She counted her calories and she exercised by walking. It was that simple.
And after about 9 months into this journey, walking was not really exercise anymore. I could walk for an hour at a fast pace and I wasn't really breaking a sweat. And that's when I decided I needed to step it up a little bit more to get that last 10 pounds off. So one day I decided to see if I could run, something I was adamant I would never do. And that day I ran a mile in 11 minutes. And it was slow and it was painful, but I did it. And that was only 5 months ago. And I'm now running over 15 miles a week.
And not only running, but starting to compete in races and getting her time is improving. It's an incredible accomplishment. Way to go, Janelle! Way to go! Way to go!
When I tell people if I can do this, you can do this, I'm not exaggerating. I wanted to be able to enjoy every moment I had with my family, because it could be gone tomorrow. And I realized that there was some level I did control, and it was every choice I made every day to go home and eat what I wanted and not be active. So on lunch, I'm out getting my steps in, I'm exercising, I'm feeling better, I'm making better choices to improve my odds, because at that level I can control it. I really thought my husband was going to die. And he never once said to me, we got to talk about this because it may not end good. He said, no, I'm going to beat this. And I figured, well, if this means I have to give up cupcakes and pop. He gave up his kidney and his hair. He was willing to do it for us. It feels good to know that I'm taking care of myself so I can take care of my family.